My name is Dr. Frank. I'm from Wiesbaden, Germany, and I'm a radiologist or in radiology since about 30 years. We are a group, a clinic that has radiology as diagnostic services and imaging, but this group includes intern medicine colleagues, cardiology. There's a great field of impact in our diagnostic work, and as well we have some knowledge and pneumonology as a field where imaging and clinical science and clinical work has very close links. So that was a question, why CARESTREAM?
Yeah, please.
It's easy to answer, because they are the best. To say it more precisely, I looked for cone beam CT since it started to be a possible new technology. And every year when I'm at the RSNA, I look what's going on that scene. And 2 years ago, I saw with this system now we decided to engage in the CS 9300, the very first one that seemed to me to be a tool that is fitting for any clinical indications we could have in our general radiology practice. And that's why we decided to get in contact with CARESTREAM, because the CS 9300 really delivered both brilliant images with extreme high resolution in combination with very low dose, especially where CAT scan needs a lot of dose. We managed, and where CAT scan is even not able to deliver resolution high enough to get diagnostic images. I'm talking about temporal bone imaging, displacement of implants and so on. In that field, we are now able to provide excellent images with tenfold of resolution with 10% of the dose we normally needed it. And that's really extreme helpful, because whenever you open new areas of diagnostic necessities, then you have to ask what is the impact on the total radiation dose of population. That's what we have to do. And taking this responsibility, it was for us no question that we cannot do this imaging even with iterative reconstruction that is now coming for normal CT. We would not manage to get in that area of dose reduction. That's why CARESTREAM. The first things I noticed was that there was not a big machine, that there was something very elegant, very sympathetic. The haptic of the system was fine for the patients. So they felt more at ease, many of our patients felt more at ease than with the CAT scan. And that was the first impression for the patient. The other thing for us in the performance is that now we are able to provide service for ENT and implantology questions on the fly. That means that we were not limited to the system time, to the uptime of our one single 40-slice scanner. That was really important for us. To talk about the installation, it's a system that has no great needs of surrounding preparations. We had one room free, and the preparation for the installation was quick done. And the team from CARESTREAM that came and installed it in a few hours, it was really without any problem. really, frankly said, I never had a system that was installed in a few hours and worked from the very first moment without any problem. Never ever. This system is fully compatible in DICOM. So we could not only store it in our packs, that's one thing, but we could do our workup on our diagnostic workstations for CAT scanners. So it was very easy to install them in our workflow. That was really important. And for those who do not have such a workstation, which is really expensive, all those know perhaps Osirix on Macintosh, and that's a really brilliant tool where everyone can have his homemade workstation for 3D applications. And that's one thing which to us was very important. To talk about what will be important in the future is one thing. You see, a very important problem is the therapy of cholesteatoma. And cholesteatoma, we know that in MRI, now with diffusion-weighted imagings and turbospin echo sequences, we have at least a better chance to really clearly depict the core of the cholesteatoma. But these images have not adequate resolution, spatial resolution. High signal, but no spatial resolution. And now what is upcoming is that we will be able in the future to fuse the images of MRI, diffusion-weighted images, and high spatial resolution temporal bone images with cone beam CT. And for this fusion, you have to have a machine that really talks DICOM. If it does talk something like DICOM, you cannot do anything with that. You never can fuse. So for us, who always look in the future, it is important to invest in systems that have a future and that are open for a future. That's why we look to the basics, that is DICOM and so on. That is where we're looking for. We do not need to have a 120% system now. We have to have a system that provides the bread and butter conditions in order to make it better and in order to be a part of the future progress. That's what we want to have, and that's what we found for us. Now we are using more than a year that we found for us with this CS 9300.